live on Friday, Black Friday night, and just want to hop on here and see if you guys have any questions because it is Black Friday and my skincare line MDR is having the biggest sale that we've ever had with all products 25% off plus a free gift with purchase of skincare. So because I know it's Black Friday and everyone's making decisions on, buying their skincare products, I want to be available almost like with office hours for you guys to see if you have any questions about the products in general. So I didn't announce this and I'm just hopping on here just kind of like randomly and spontaneously, but wanted to see if anyone had any questions out there. Also, I'm a little under the weather and have been hosting family and have had house guests for the last week at my house and hosted Thanksgiving last night. So I know it's been a little crazy and I'm under the weather and just wanted to like hop on here and see if anyone had any questions. So again, I did announce this, but if you happen to be on right now and we can hang out, it would be really, really fun to answer your questions. So I'm going to try to keep it based on skincare because I know I do my lives usually and I talk about like aesthetics and dermatology or procedures and lasers and things like that. But because it is, kind of a skin care focused live, I'm going to just kind of focus on products. So ask away anything. As I said, what's that? Hi guys, you're so sweet. And I love that I'm sharing information with you guys. And you guys always have the most amazing questions, and I want to be able to like answer them for you, not only about my skincare line, but any other skincare that you're trying to make a decision about. Because when you're spending your hard-earned money on a product, you want to spend it on something that's going to give you reproducible real life results. And so that's why I wanted to be here for you guys today. So let me know what you guys want to hear about. And I'm probably going to be doing another Q&A live on YouTube on Sunday morning as well, and probably have it more skincare focused, but we'll see. And wanted to see what you guys wanted to ask me about. So somebody's asked me about Sculptra, and although we're going to try to keep it about skincare, Sculptra, for those of you who don't know, is a biostimulatory filler. It's an injectable, and it's gaining a lot of popularity now as we're shying away from hyaluronic acid fillers. But it's a great naturally occurring signal transduction cascade in the skin that is in response to a stimuli to produce collagen and add volume, as opposed to like passively adding volume from a mass effect of a foreign body being in the skin like hyaluronic acid fillers. So it's gaining a lot of popularity and a lot of patients like it more because it's more natural, because it's inducing your fibroblasts, the collagen producing cells, to make more collagen, as opposed to just like putting a bunch of filler in your face. And by the way, I had all my filler dissolved. So I know, it's everyone has a different journey, but filler that has been around for more than a few years, it can change the consistency, and it usually doesn't migrate unless it's injected incorrectly and it's the wrong dermal plane and it's the wrong product and so forth. But usually if it has gotten like incompletely metabolized and it starts to change consistency, you can just dissolve everything and start from scratch. So that will be a different topic for a different video, but I wanted to like see what you guys are asking about for skincare. Okay, so can plant-based exosome and growth factors cause unwanted growth, or is it just human-derived contained media? This is a great question because a lot of data shows that like exosomes and growth factors, especially if it's a narrow, like a peak in a band of like if you have like a whole array of growth factors, if they're like multiple different growth factors in a very even distribution of like all different forms of growth factors, it's less risky for like growing like sebaceous hyperplasia, skin tags, things that we don't want. When there's a peak of a certain growth factor and the other growth factors are kind of minimal, but there's like a rise in just one particular growth factor, those are the ones you have to be aware of. And those, were kind of the more common growth factor serums back like 5 years ago or so. So I think things have gotten a lot more elegant, but I'm a peptide proponent. I'm science-based, evidence-based. I'm also a skin cancer surgeon, and as part of skin cancer surgery, we would always have to stop all of our patients from using exosomes and growth factors. And so because that's part of my training, I don't put those in my products, and I really feel like you can get the same results and even more elegant and customized and pinpoint using like peptides that are signaling to the cells that are you want them to do a certain downstream cascade, like stimulating collagen, stimulating elastin, increasing cellular proliferation or renewal, or renewing the barrier, or optimizing cellular function without like inundating the skin with all these like growth factors that are going to just make these skin tags and sebaceous hyperplasia and potential neoplastic lesions. So anyways, I'm not a big exosome person, but I think that, for those of you who use exosomes, I think plant-based may be a little bit safer than, human-derived exosomes and growth factors, especially like if you think about like some of these human-derived growth factors are coming from like foreskin of like baby penises. Like I wouldn't want to put that on my face. So I'm gonna stop right there and see what other questions you guys have. You guys are always so fun on YouTube. I love that we just did this spontaneous. And here we are hanging out on a Friday night. And I'm sick, so if my voice sounds weird, that's why. But you guys are actually making me feel better. I just had some soup and we're just chilling on a Friday night on Black Friday. And I'm probably shopping just like you guys are. Okay, for my kids though. What are your thoughts on all therapy? Okay, we're gonna save all therapy and device questions for a later time because we're gonna make this more skincare based. So somebody asked, is hydroquinone safe? I have hyperpigmentation and a darkened complexion. My biggest concern is rebound hyperpigmentation. Okay, so you brought up a couple good points. So hydroquinone, as an American board certified dermatologist, I say yes, hydroquinone is safe. However, it has to be in the right percentage and the right treatment protocol to be safe. Now, there were studies that were involving lab animals who were ingesting large amounts of hydroquinone, and there was a potential malignant neoplastic potential. We're not ingesting it. Remember, all out of a body surface area that's like about this big, when you apply something topically onto the skin, it's about the size of your hand, 1% gets absorbed. So unless you're squirting the hydroquinone down your throat and drinking it, it shouldn't be harmful. But you can worry about ochronosis, which is paradoxical skin darkening when you use hydroquinone to treat hyperpigmentation, but then it causes these ochronosis patches where you're like darker and the skin gets stained. So that you want to avoid. But honestly, for like a 4% tapered use, now some people will do 3 months on, 3 months off. Some people will do 1 month on, 2 months off. Some people will just use hydroquinone in the summer and then not use it in the winter. And as long as you're like taking a holiday and a break, you shouldn't be at risk for ochronosis. Now, rebound hyperpigmentation happens when you withdraw it like cold turkey. Like say you've been using hydroquinone consistently for a certain amount of time and then you all of a sudden stop it. Like you wouldn't want to just stop it and just not use it anymore. Usually, derm, we usually like to go in 2-week intervals when you're tapering on or off a pharmaceutical or a medication or a topical cream with actives. And usually you'll do like every other night for 2 weeks, and then every third night for 2 weeks, and then every fourth night for 2 weeks, and then you do it once a week for 2 weeks, and you see how your skin responds. And sometimes with melasma, really recalcitrant, which means hard to treat melasma, you got to go low and slow. And sometimes people never get off hydroquinone, but they're using it like once a week. So it all just depends. Everyone's skin is totally different. The melanin synthesis pathway is upregulated and downregulated. Skin thicknesses are different among different patients. So that's not, so just go through this with your provider. And even if you're my patient, I always tell my patients, like, just see how your skin responds. And if you can stop it and your melasma or hyperpigmentation is not coming back, then you're good without it. But if you get that happy medium, like, oh, if I cut it any out more than this, it comes back. But you get to right above that point, and then you can kind of maintain a longer term use of hydroquinone. And honestly, 4% is all you need. 2% is too low. That's over the counter. Anything 6, 12%, then you're putting yourself at risk for ochronosis, in my opinion, without like the benefit of a really efficacious hydroquinone that's mixed with other active ingredients to propagate its efficacy. So I love the Zeo Pigment Control Kit. I love that hydroquinone system. If you're a patient of mine and I've lasered you, it just really is a great combination of hydroquinone, other actives, and a lower percent, so you're not like dousing your skin with this 12% hydroquinone over a long period of time. Okay. Let's see. Hello, my friend. How are you? Good. Love you guys. Okay, some of these are a little bit weird. I'm gonna keep scrolling. Let me see. Oh my God, some people are so crazy. This is why I kind of have to refrain from posting on my social media, like my personal life and my kids. Okay, anyways, let's move on. It says PRF help under eye hollows, and what other treatments help? Again, yes, it does, but we'll save that for a different live, and we'll save that for a different session in the future because I want to focus this mainly on skincare. All right, let's see. Okay, some people are being a little weird. Okay, it's Friday night. Not talking about growth factors. Okay, I would talk about growth factors and skincare and pharmacology and skincare products all day long. Let's see. Okay, this is not what we're going for, so I'm gonna probably end this soon. Let's see if there's another skincare question. It's a bunch of crazy randomness. Okay, what's the difference in the prescription? Hold on. What's the difference between your prescription retinol and your MDR retinol? Also, what product would you use rest of your life? SPF and what else? That's such a good question. So if I had to pick one product as a dermatologist to use for the rest of my life, it would honestly be a tie between a retinol and a vitamin C. So retinol, which is a vitamin A derivative, retinol has the most overwhelming and profound data and evidence and research backing up its benefit in the skin. So whether that's a retinol or like a prescription strength tretinoin, even people who have more sensitive skin have to do like a retinaldehyde, or they have to do a, like a lower percent retinol because their skin can't tolerate a tretinoin. That is probably the most impactful over years of use long-term for your skin over a lifetime. So I would definitely go with a vitamin A derivative like retinol or tretinoin. And then a close second is vitamin C. Vitamin C is a very underrated skincare active because it's an antioxidant. It helps bind free radicals. It's a free radical scavenger. It repairs damage that has been done to the skin and protects the skin from harmful effects that are in the future. It also helps in the melanin synthesis pathway to help regulate melanin synthesis so you have an even tone and you get that glow in your skin. It's good for acne, anti-aging, fine lines, wrinkles, collagen stimulation, all of the things. So I think that I would have to say it's a tie between a retinol or vitamin A derivative and a vitamin C, but definitely sunscreen. I mean, SPF is one of the most important skincare actives or ingredients or products you should use on your face, neck, and chest, backs of your hands, day in and day out, starting at a very young age, and it'll definitely pay off later. All right, one more question. Favorite neck cream, the Neck Tight Serum, you guys. I mean, I'm obsessed with it with my neck. I'm 48 years old, and I'm obsessed with my neck and décolleté, keeping that firm and tight, upregulating collagen and elastin synthesis to keep this smooth. And so my Neck Tight Serum by MDR, and all products are on sale for 25% off now, and it's not going to ever be this good. Like this, take advantage of the sale now. Now is the most affordable time for you to use and try MDR and see what it can do for your skin. But the Neck Tight Serum has active ingredients specifically for that delicate, thin neck and décolleté skin, and it also has topical argireline in it, which, not to get too scientific, but binds a synapse nerve complex and smooths the skin. It's like topical Botox, like Botox in a bottle to help with the neck and décolleté. So that's probably my favorite neck cream, honestly, because I engineered it with, my patients in mind and myself, and wanted something, I wanted something like for myself that I could give my patients after, say, they invest their, money into a laser treatment on the neck and décolleté, and they want to maintain the results and keep that skin nice and tight. The other thing about the neck is that, like, a neck lift is only going to last so long. I mean, my plastic surgery colleagues will talk about this all the time. It's lotions and potions for the neck. It's injectables, because you can do a neck lift and that will look good for a year, maybe 2, 3. But if you're doing surgery on skin that doesn't have collagen in it, it's just going to fall again. It's like, taking like a wet paper, like a wet, like tissue paper, and you're like, you tighten it and it sags again, then you tighten it and it sags again. You can only do a neck lift, maybe 2 times in your lifetime, maybe 3, without looking weird. But you got to keep the collagen stores up in your skin, on your neck. Like, that is the key, and that comes from actives. You doing Botox and stuff, and biostimulatory fillers and lasers help too, but you got to keep that skin tight. You can't just say, oh, I'm gonna get a facelift or a neck lift in 10 years and then everything will be fine, because you may wait 10 years and get that neck lift, but then 2 years later you'll be right back where you were before. Maybe not that bad, but I have patients every day in my office come in and they're like, I just had a neck lift 3 years ago and it looked amazing. Now I have saggy neck skin again. You got to invest in collagen synthesis in the neck and décolleté long term. And I can't say that enough. And now that I'm old, I can say that, because I've been doing this stuff on my own neck from when I was in my 20s. It definitely pays off. Let's see. Okay, one last skincare question, guys. Keep this with skincare because there's so many weirdos on here right now. I guess it's a Friday night, but I'm sick and just trying to help out you guys. I'm staying home on a Friday night. You guys should be out and having fun or asking questions about skincare and dermatology. Okay, somebody said your lip lift looks so good now. Oh, thank you. I Botoxed it, so I'm not. Yeah, I think it's settling in pretty well. Okay, one more question. Hello from Australia. Oh, hey, good to see you guys there. Let's see if I can ask one, if I can find one more skincare question. Let's see, you guys. Okay, this is a Botox question. Let's see. I don't see any more skincare questions. And somebody's asking about Fudex. Okay, so Fudex, for those of you guys who don't know, since this is a skincare question, it's a prescription strength like anti-cancer and chemotherapy cream, and you have to use Fudex guided by your provider. That's prescription strength, and although I'm board certified and medical provider, I can't give medical advice over like a YouTube channel. So follow up with your provider with any Fudex questions. And then somebody said, does your eye cream help with hollows and fine lines? The answer is yes. So the ECM eye serum was my first product that I engineered for my own skincare line, MDR. And I wanted to create my own skincare line because nobody was up to date with the technology and the innovative, changes that are happening in skincare and in dermatology. So I wanted to be able to provide my patients with the most up to date, delivery systems and products and active ingredients and technology in skincare. So the first product that I engineered was the ECM eye serum, because there wasn't a good eye serum on the market. And so the under eyes are the first to show our age. Like when we smile, the fine lines and wrinkles that show under the eyes, even in our 20s, are a result of a collagen loss and elastin fiber loss in the skin and that thin, delicate skin. So you need active ingredients specifically engineered to upregulate collagen and elastin synthesis under the eyes. So the ECM eye serum does that. So it smooths out fine lines and wrinkles. I use it 2, sometimes 3 times a day. I put on with a little contact applicator even when I'm in clinic to keep my under eyes hydrated, the barrier restored, and collagen synthesis upregulated in that delicate under eye area. But it also helps, it has active ingredients that help diminish the appearance of under eye dark circles. So you get under eye dark circles as if we're dehydrated, or it can make us, if we're losing weight or as we age, the dermis and epidermis thin over time. And you see the underlying blue, gray, purple hue under the eyes. And the reason why that happens is because the skin thins. So you want vasoconstricting actives like caffeine, green tea, polyphenol, polypodium leukatomas, DNA repair enzymes, things that are going to vasoconstrict under the eye and to brighten up the under eye. Also, that are going to, smooth and tighten the under eye fine lines and wrinkles, and then also depuff under eye puffiness. So the ECM eye serum, now would be your time to get it, because again, all products are 25% off on my MDR website on the skincare line, and you guys should experience that and give it as a gift, because once you use the ECM eye serum, you'll understand what a good eye serum can do and how much it can do for you. So on that note, take advantage of the sale that's going on now. We also have free gift with purchases of skincare, and we're going to be doing this throughout now Black Friday, Cyber Monday, and it's not going to get better than this, guys. And I rarely do promotions, and they're few and far between, and they're not going to last long. So take advantage, and that's why I want to hop on here and see if I can answer any questions regarding our skincare products. So anyways, have a nice night. Love you guys, and I wish you the best of luck. If there are any weirdos on here, sorry if you guys were looking at weird things being said in the comments. I just let it roll off my back, and I've gone thick skin over being on social media for such a long period of time. But I love you guys. Happy Friday. See you soon.